Well, there is a development tonight in the spread of that parasite in the U.S. that is causing thousands of cases of severe diarrhea. Officials in the state of Michigan say that they've identified fresh food as a possible source. Now, what you're looking at here is an image of the microscopic Cyclospora parasite. U.S. health authorities say there are now cases of cyclosporiasis in at least 31 states. Officials caution that fresh produce, such as salad greens, and raspberries may not be the only source, and they cannot rule out other food items. And joining me now to talk about a not so pleasant topic is Dr. Caitlin Rivers, epidemiology professor at Johns Hopkins, and she's also the author of Crisis Averted. It's a book about the hidden science of outbreaks. Dr. Rivers, it's good to have you on the program. This parasite, as I understand it, it is spread when traces of infected human feces make their way into a water source that is used to irrigate or clean produce which people then eat. Now, there are a lot of links here for this to become a chain of events. To a layman, it seems that this would not happen very often in nature. Am I right or wrong?
Contamination often happens at the farm level or in the production process. Foods get contaminated at the source and then they're distributed to supermarkets, restaurants, and purchased by consumers. Most Cyclospora outbreaks previously have been associated with imported produce, things like raspberries, lettuce, bagged salads, and so those are the items that health officials are considering right now.
I understand that Cyclospora is not endemic in the United States, and as you said, these outbreaks have historically been related to produce that was imported from countries where Cyclospora is common in the population. Is there any reason to suspect that this outbreak is different?
Not at the moment, but this is a very complex investigation. There are thousands of people who have become infected, and health officials are following up with all of them to ask what they have eaten in the previous weeks, restaurants they've visited, and so the data collection is very much underway. We heard from health officials in Michigan yesterday that lettuce products are rising to the top of the suspicion list, but we haven't received final confirmation just yet.
Yeah, you mentioned Michigan. As things stand tonight, most cases are in the state of Michigan. Does that tell you anything as an epidemiologist?
Well, I have my suspicions. One hypothesis that I'm considering is Cyclospora is a difficult disease to diagnose. It's not on the standard workup panels that your doctor would consider if you go to see the doctor for diarrhea. It has to be specially requested. And so one thing I'm considering that may be happening in Michigan is there is a cycle or a feedback loop where there is a lot of awareness, there are a lot of cases being found, and so doctors become more aware, they order more search for the diagnosis more, and so forth. And so I think that while it's certainly clear that Michigan is experiencing a large burden of disease, I don't have reason right now to suspect that they are different in that way than, say, New York or Ohio, which also have large numbers of cases.
Doctor, do we know how much Cyclospora is required to make a person sick?
Not very much, and that's part of the reason, and I think this is important for listeners to know, that rinsing your produce can help to reduce your risk of infection, but it's not reliable. And that's because the contaminant is quite sticky. It can get into crevices in raspberries, for example, or on the underside of leaves, and that makes it difficult to wash away. And so while rinsing is recommended to help to reduce your risk, it's not going to be the sort of for sure that we might think of when we're thinking of washing our vegetables.
So what are you doing then at home? Are you, if you want to make a salad, are you washing your leafy vegetables, or are you just saying for a while, let's not eat produce?
Recognizing that we will soon have a definitive source and we'll be able to be more targeted in our restrictions. Personally, I'm choosing to steer away from bagged lettuce and bagged salads right now, and that includes at restaurants. Instead, I'm choosing frozen and cooked produce. It's raspberry season, it's berry season, and that's a hard one to turn away from, so I'm sticking with the raspberries for now. But people who are immunocompromised, infants, older adults, they're going to be at higher risk of severe illness, and so they might choose to be more cautious in this moment.
And also, I mean, just the practicalities of this, cook your produce. We've been hearing that the last couple of days now, but I mean, if you're going to make a salad, you don't cook your spinach leaves, right?
It's a risk right now. It's a risk right now because there is this Cyclospora outbreak, and we don't know for sure what the exact product is. Instead, you might choose to go forward anyways and assume the risk. But if you did want to take a more cautious posture, you might choose soups, you might choose stir fries, you might choose frozen produce. Those are all other options.
I know some people have been saying that we should do maybe what they did 100 years ago, what our grandmothers maybe would have advised, and that is cleaning produce with vinegar or vinegar and water. But is that foolproof?
Again, not foolproof. This is a very hardy parasite. It's resistant even to chlorine disinfectants. And so there's no real easy way available to consumers to make sure their produce is safe at this moment.
And should we be concerned? I mean, I know you're saying that they're going to find out the source of this, but it still begs the question, though, has there been a breakdown somewhere in cleanliness standards, hygienic standards? And is this the result of having a food industry that is a mass industrial industry where food is being exported and imported from all over the globe? We eat something that could have come from the other side of the planet. I mean, all of these are risk factors that do we either have to learn to live with, or are these risk factors that are going to make us sick?
It is disconcerting. I understand, especially in this moment where we don't know what the causative item is. I think what we can expect as consumers is a very thorough reporting of the outbreak investigation. What was the contaminated product? How did this happen? How did the investigation unfold such that maybe next time we can get an answer faster? Those will be the kinds of answers I will be looking for in the weeks and months ahead. And I think that will give us some more insight into where the weak links in the chain are, where we could potentially think of making changes to improve our food source system.
Yeah, well, we certainly hope that all people who do become ill, that they get the proper treatment, and let's hope that people who have weakened immune systems, as you say, that they are spared this parasite. Dr. Caitlin Rivers, good to have you on the program. We appreciate your insights tonight. Thank you.
Thank you.